Okay, so when I'm doing these readings of these scans, I'm not trying to give you a comprehensive description of all the findings, but we are going to discuss certain key findings so that we learn something from each study. Okay, so don't worry if I'm not picking out some of the findings in each one, because I'm not focusing on all the findings and I don't want to throw a lot of information into the case. So let's look at this paranasal sinus coronal plain CT scan, bone algorithm. Okay, let's see what's going on in this. So as you can see here in the left maxillary sinus, you can see a polyp. Okay, how do you know it's a polyp? Because it's got these nice convex margins. It'll be nice lobulated, sitting in the floor. Some areas of this can show areas of calcification or concretion seen inside, where it becomes dense. In descriptions, there can sometimes be, you can describe thinning of the margins of the sinus, or sometimes there could be sclerotic changes. Okay, either a mixture of both, it doesn't matter. Okay, but you can mention it. So here we have a large left maxillary sinus polyp that is sitting in the floor of the left maxillary sinus. The drainage pathway appears patent and open. All right. If you look at the right maxillary sinus, there's a little bit of minimal mucosal polypoidal thickening in the floor. And I can see again similarly in the left frontal sinus, there is a small polypoidal mucosal thickening. All right. And let's just look at the nasal septum. So the septum over here, when I start from anteriorly, the cartilaginous portion, which does not have any bone, appears without any deviation centrally. And as I go posteriorly towards the bony septum, there is a shelf-like projection towards the left side. So this is a septal spur. Okay. So as the spur projects into the left nasal cavity posteriorly, you can see there is less room in the left-sided nasal cavity posteriorly. As a compensation, there will be more roomy space in the right nasal cavity, as a result of which there will be compensatory hypertrophy of the turbinates on the right side. This is a normal finding, but you need to document it. So you say there is a posterior left nasal septal deviation with a left-sided spur. You can describe the dimensions and the size in multiple planes as you wish, and you can mention the compensatory hypertrophy of the contralateral, in this case the right, middle and inferior nasal turbinates. Okay, so these are the learning points in this paranasal sinus CT scan.